slides, Addison.
Yes,
You're
that's
driving?
correct. Yep.
Okay, let's move into the budget update, Addison, if you're ready. So most of you are quite familiar with the state budget process. It's really there is no start and end to the state budget process. It's just who's working on it at what stage. So we are in the April, May down below, where the governor has released her budget, the House and Senate have finalized their budget proposals. We anticipate that the House and Senate will name a conference committee to negotiate the differences between their proposals in the next probably few days, right, Addison? And we will have an opportunity, as I'm sure all of you will, to work with the conferees. And when the House and Senate finishes their negotiations and have a final budget, they will send that to the governor for her consideration. Okay. So next slide, Addison, unless you want to say anything about the process I missed. Folks have questions.
I think you hit the nail on the head there, Commissioner.
Thanks. Okay. So as I said at the beginning of the meeting, that all three budget proposals, the governor's budget, as well as the House and Senate. Oh, okay. Thank you, Representative Lewis. Good to know. Have been named and had their first meeting this week. Terrific. Okay. Well, we are looking forward to working with all of you and to working forward to working with all of you and to the conference committee members. Okay. And as you'll see, there are quite a number of differences between the House and Senate versions of the budget. So EC will definitely be a key discussion item, I'm sure, along with other things. But I just want to start by saying all three budget proposals, the governor's, the House, and the Senate, are incredibly supportive of the agency. We are at $1.55 billion. In each proposal, there are differences and variations in language and funding levels and line items, but all three represent incredible support for the agency and across really three key areas that we're going to hit on. So childcare financial assistance, Commonwealth Cares for Children, and our other workforce program supports. And in the board deck, I don't know if it's here, Addison, but in the board deck, we have kind of we'll go into this in a little bit more detail, and we'll have a full sort of line item. One of the things that's complicated about this year's budget is that the funding sources are coming from not just general fund, but also the high quality trust and from fair share. So one of the things you'll see is a single program like Commonwealth Cares for Children might be funded out of multiple different sources, so it appears as different line items. So we've tried our best to try and consolidate by program so people can see the overall impact. Okay, let's. I'm gonna go through the next three slides very quickly, but I know these slides were to you, and then I'll spend a little bit of time on the House and Senate differences so that everyone's sort of aware of those. So slide 6, Addison. So these are the line items and the funding levels across the three different proposals around childcare, financial assistance, and engagement. And those include everything from our vouchers and our contract funded programs for our priority and income eligible, as well as funding for Head Start, Reach Out and Read. And you can begin to see some of the differences in funding between the different levels across the three versions. I'm just gonna hit these really quickly and then spend more time on slide 9, so we don't spend too much time. But I'm happy to go back to any of these at any time. Okay, let's hit the next slide. So the Commonwealth Cares for Children program, I want to just say that this is funded in all three versions of the budget at $475 million, and that is fantastic and continues to set us apart from other states where these initially federal era funds have sunsetted in most states or been partially funded. And we continue to be, I think, the only state that has fully committed state dollars to continuing the Commonwealth Cares for Children program. As I mentioned, we're going to spend a lot more time at the board meeting next Wednesday talking about what we are hoping 25 will look like for this program as we continue to make the transition from this COVID era stabilization to what we hope will be sustained ongoing operational supports for programs, and recognizing the incredible feedback we've received from you and other members of the field and the legislature about sort of important directionality for that program as we try and make it a more sustainable and consistent part of the funding landscape. So all three versions at 475 coming from slightly different sources. And you may also be aware, if you're close budget watchers, that all three versions have quite different language associated with the C3 program. Much of, I think, the Senate's Early Education and Care broad sweeping bill has been included in some outside sections in the Senate version of the budget, including codifying the C3 program. There's some important outside sections also from the House side. So this will be a very important part of the conference committee discussion as it moves forward. Okay, let's hit on slide 8. And then our other workforce and program support, so our quality improvement, that 47 million, that's at the top, funds a number of things, including all of our licensing staff and our quality support staff. So it's kind of a large line item, and a lot of it goes into sort of our licensing infrastructure, but also funds some key quality support programs. The CPPI program funded at different levels. The Senate did support a significant expansion in that program. And then conversely, we see Career Pathways is in the House budget at 10 million, which continues level funding for that program, while that line item is not in EEC's budget in the Senate version. Okay, let's hit the last slide for quick kind of side-by-side comparisons. So as I said, both versions with C3 at 475, we couldn't be more thrilled with the support for this program, and are looking forward to the discussions about what that program is going to look like into 25 and beyond. In terms of the rate increases, consistency actually across the governor's, the House, and the Senate version, although it's hard to find this because it's funded in different line items. Some appear in our caseload accounts and some are funded through Fair Share. So what we have been able to decipher in terms of intent and structure is that the $65 million rate increase that we implemented in this fiscal year is fully annualized. That has to be done in order for us to carry those through. In addition, all three versions of the budget proposals include an additional 20 million for a rate increase for this coming fiscal year. In terms of access, so this is child care financial assistance, that's vouchers and contracts. On the House side, 20 million in our caseload accounts, and another 8 million that was earmarked specifically for early education and care staff. On the Senate side, 80 million for child care financial assistance, so increasing our caseload accounts by that amount. The governor's budget included 75 million for that. So we are hoping to be able to reach many, many more families into the next fiscal year, and to maintain the number of families that we've enrolled this year as well. Differences in both versions, again, around the CPPI, a $15 million expansion on the Senate side. For Head Start, slight variations, both above the governor's House 2 budget for our Head Start state supplemental program. As I mentioned, 10 million for Career Pathways in the House, not included in the Senate, at least in terms of the EEC line items, but may be included elsewhere in terms of the big supports for community colleges and free community college. The Senate also includes a pilot, 2.5 million for an employer-sponsored childcare pilot program, and 6 million for summer step up. The House budget included 20 million, two separate earmarks within our administrative account for a new higher education, early education scholarship program, as well as a new loan forgiveness program. So incredible support across both versions, and some significant differences that we know the conference committee will be looking to discuss and sort out. Okay, why don't we stop sharing for a minute and we can see if there's questions or thoughts. I think, did we send the slides out yet, Addison?
No, they will be sent out and posted on the website after the meeting.
Any questions or thoughts, or I would say corrections, because I know all of you do really good meticulous budget work, and this was not that easy a budget to completely figure out how to present. Go ahead, Beth Ann.
Thank you. Hello, Commissioner and everybody. Thanks for that presentation. We do look at it, but this is helpful to have you digest it and lay it out that way. So looking forward to getting the slides. And obviously the C3, I just want to express on behalf of all the community action agencies, the incredible appreciation we have for that allocation, obviously to the House and the Senate and to the governor. Really important resource. My question is, on the early educators subsidies, what was the take up on that the last, maybe this year, last year? I'm just wondering, are they being fully utilized, or what is your sense?
It's a great question, and I can let Tyrese jump in, but I'll just say it was a runaway success. So I think we enrolled upward of 2,000 families, reaching more children, and with the having achieved our appropriated level, we are now seeing some of those staff going on the waiting list with a priority code, so we'll be able to pull them off. Again, really hoping for at least the 75 million that the governor put in the budget, so that we're able to reopen access soon after the start of the fiscal year, with a high priority on reaching staff. Tyrese, what did I miss?
Great.
Where are we at? Over 2,000 now?
Yeah, we're over 2,000. The count is 2,322 for enrolled, and we have a number. It looks like we have a number still waiting on the wait list due to the limits on our appropriation.
Okay, so there it is, and you're keeping it. That's a separate wait list.
We are not. What we did through the new policy development, we ran this as a pilot to start to see how it would go. And very soon it was clear that this was an essential both family access as well as workforce effort. So we built it into our policies as it was designed so it is now an ongoing priority at a higher income level currently than, so 85% of state median income and with priority access to income eligible vouchers.
Okay, and is it, I'm sorry, one last question. Is it
Sure.
2,300 children or 2,300 educators?
Children.
Children, great. Thank you.
You're welcome.
Laura.
Well, thank you. Beth Ann just covered my first part of the questions because it's been so hard to follow. Is it funded? Is it not funded? So what I'm taking away is that it's funded as a part of any access caseload increase. So Tyrese,
Right.
You were saying it suffers the same limitations, but it won't necessarily have its own separate funding, although they do have different income eligibility. Did I get that right?
That's right, but
Okay,
it matches our
sorry.
special needs population. So, they're anyone up at, and families, come in at 50% of state median income, but stay into 85. So right now they can be eligible at initial eligibility at 85% of state median income. And we just built them in as a priority. So the 80 million that the Senate put in, or the 28 or 20, we wouldn't necessarily limit to just the 8 million that was earmarked for it, because we've built them in as an ongoing priority within our overall policy.
Great. And I share the same thanks around the continued importance of C3 grants, but I also wanted to ask about the CCFA funding levels, because at least as you know, and as many of us know, the both and strategy of those two funding mechanisms are critical, both to family access and to provider stability. So while we talk about the 65 million annualization. Annualization has always been a part of the way rates are done. But the 20 million increase is basically 2%. That's the smallest that it has increased in quite some years. So and since there's a lot of consistency across the three budgets, I'm just wondering how you're thinking about that impact on workforce investment, on provider stability. It was a big increase last year, granted, but a very small one now. So I don't know how you think this will interplay with the goals of access and stability for the providers.
Yeah, I mean, I think that's a bigger question than probably we can answer right now. That's like the bigger, like maybe we get to the research agenda that really, because part of what, you know, the both and strategy, which we all collectively have been pushing, right? All three levers need to be pressed. We need needs-based assistance for families who can't afford childcare, including our educators, as we were just talking about. We need funding going to the programs for financial stability and the ability to make investments in staff through C3. And we need rate increases to incentivize people to participate, to pay you closer to the cost of care. And we made huge reforms last year and progress in that area. And the way I would see whatever the final number is, that we would continue down that path of trying to bring folks closer to the cost of actual care. And, you know, we are continuing that research work as well, so that we can continue to make data-informed decisions about how those rate increases get implemented. So I feel grateful that all the levers are reflected in the budget proposals. Of course, we would always want, you know, as much resources to go into the system as possible. Maybe that's a question. Maybe it's a rhetorical question, Laura.
Thank you.
Sure. Any other thoughts and questions for us now? And I know we have some legislators here listening as well, so thank you for being here. Okay. Let's get on to the state plan. Equally as complicated, maybe, but I don't know. So I want to thank you all for the time you took, and also to the team at EEC who's been working their way through this very large administrative task. All right, Tyrese, take it away.
Thanks, Commissioner. So as the Commissioner opened, she said the last time we were here, we were together it was Workforce and Advisory together. And Jocelyn and I and Amy Checkaway were talking about the state plan. At that time, we had just, you know, kicked off our development process. And I'm happy to say we're at the end. We're at the end of our process. So what you see in front of you is the initial timeline we showed related to the state plan and related to the CCDF state plan, along with the key areas that the state plan addresses, which all of these 10 key areas are directly connected to the areas of work that we do here at EEC. We started our engagement in January by you know, looking at our old plan and looking at the new one and starting to really see what was different there. And then we notified the board in February of the state plan, its requirements, and how we were going to move forward. A big part of the development process is really stakeholder engagement. So we're just finishing up our stakeholder engagement, which the last piece of it was our public hearing and the public comment period. So through March and May, we've engaged with a number of different stakeholders, a number of required stakeholders, from our Head Start partners to our CPPI partners. We also tried to engage with our local tribes through that period, and then we engaged with the public. Next slide, Addison. And where we're currently at is we're at the point where we have reviewed all of the feedback we received from all our constituents. Next slide, Addison. from our constituents, and we looked at the different areas of that feedback, and where we could make adjustments, we made adjustments, and where we couldn't make adjustments, we said, hey, is that something that would require a higher level conversation, whether it's a policy decision, or is it something that's going to come during the 3-year period? So our current state plan will end September 30th. And once approved, our new state plan will start at that time for a 3-year period. What you see in front of you is an overview of what our stakeholder engagement looked like. And you'll see we had 6 engagement sessions. Over 21 organizations represented. Many of you were on those organizations, so thank you. And we received a total of 45 comments. And a lot of our comments that we did receive started off with accolades, thanking us for the work that we've done thus far to really improve access for family and to consider the needs of the workforce. And so we thank everyone for your support there. And then we received other comments that pushed us in areas of increasing capacity for infants and toddlers, thinking about putting more attention to coordination as it relates to continuity of care for children that may be in other types of programs, whether it's CPPI or Head Start. We also received comments around addressing the needs of private pay families, like how is EEC looking at private pay families in the next 3 years, and to also to push EEC to continue to address access barriers and access gaps. And then the last couple of comments we received are related to mental health needs and looking at the higher needs of children in early education programs, and looking at what are the state standards around mental health supports for our earliest learners, and also supports for our childcare workers, right? Has EEC ever considered any level of additional state-sponsored supports, lower cost professional development, or other state-sponsored benefits? So I'm going to pause there to see if folks have any questions. Can't see any hands. So what's next? What's next for us is we'll be presenting.
Sorry,
Hi, Amy.
It's Amy. I couldn't get to the raise hand. And you might not know the answer or like have enough information, but this concept of the private pay and thinking across a continuum, are you hearing from other states, like how is it showing up across the country? Because I think this is especially with the operational grants that that Massachusetts is kind of committed to this across the system, and then how will that influence as you think about the state plan for here?
So it's interesting, the comments we received related to how we're looking at private pay families was ensuring that they have the consumer education related to the different types of programs like out of school time programs and other programs as well. It was directly related to consumer education. As it relates to what I'm hearing from other states, I don't know if other states, where all states are so, have been so focused on the new 2024 CCDF plan that we weren't specifically, we were just together, I was just together with a number of the East Coast states in May. It wasn't something that came up, right? What we did hear is that, what I have heard is that many of the other states, their local, counties in some states, their county administered, are implementing their own types of supports for private pay families.
Okay, thanks.
Yeah, you're welcome. All right, so before I go into the final rule, I'll just say the next steps on the state plan is we'll be bringing it to the board for a vote, which is required. Once we receive the vote from the board, we'll be finalizing the plan and submitting it to the Office of Child Care. The process after that will be, they'll be asking us some questions, probably clarifying questions, and then we'll receive, once we receive the approval, the plan will be in place for 3 years. Okay. Next slide. So I'm gonna pause. Are no other questions related to state plan or engagement? Laura, was that your hand? I
Yes,
only
sorry.
can see you and Beth Ann and Amy on the side of my screen.
I couldn't get to the button either. Thank you.
You're
Just,
welcome.
I was just looking through the overview slides, but is there an access link to actually see the plan? Because it's more of the slides are more like the headings.
Yeah, to see the plan, we can put the link. The plan, there is a website that has the plan, that has the actual plan on it. So we'll get that in the chat.
Right,
for you.
I'm sure it's overwhelming in size, so I may regret ever asking, but I wanted to,
191 pages, Laura.
okay,
What
so
I
maybe
will
not.
say- Wait, let me go back. So what I can tell you about it is, even though it's a large number of pages, the sections, right? The section headings, the topic areas will make it pretty easy for you to navigate through. Right, and we broke down those topic areas in the overview slides that we provided previously, that according to strategic objective areas. So it will help, you'll be able to easily navigate to the section you're interested in reading.
Okay, and just a big thank you to you and the team for 191 pages of effort.
It was a huge effort. It was I can't tell you how many of us worked on it. And so I'm very grateful to the team. It was definitely, we couldn't have done it without the group that we have. Thank you. All right. So I actually am happy to talk about the 2024 CCDF final rule. The final rule, as the commissioner stated, is the way that the federal government makes changes to law, right? What they make changes to a regulation or the policies and procedures that we follow to administer childcare financial assistance and other programs as it relates to early education and care. Next slide, Addison. Right. What we provided here is just like high level, what is the final rule and what is the rulemaking? It is really the federal government's way of making changes, right? They either can make changes to existing policies and procedures, or they can also remove, right? They can rescind a previous regulation. And so the new 2024 rule, it is actually they're not necessarily rescinding anything. They're actually making improvements and making changes in 3 key areas, which directly align with the work that we've been doing here at EC. And so those 3 areas are lowering family cost, ensuring better payment practices for providers, and making enrollment easier and faster for families. Right. What I loved about this rule is that the focus is really on supporting the field, right? It's supporting families and also supporting providers and our educators. And they outline things in a pretty easy way for states to follow. The rule is effective April 30th, and states that aren't necessarily in compliance with all the provisions within the rule, they will have 2 years to come into compliance. What's key to note here is that the rule, they broke it out into encourage. You can go to the next slide. They've broken out the provisions of the rule into like sections. So they have like things that are required, right? They have policies that are required, and then they have policies that are encouraged. All the states, or as our Office of Child Care calls us, lead agencies, are required to meet the required provisions. And so the required provisions you'll see in front of you are co-pays capped at 7% of a family's income, paying providers prospectively, paying providers by like enrollment-based payments, offering some grants and contracts, right, for infants and toddlers, children with disabilities, and children in underserved areas, building a non-traditional hour supply, and then ensuring that policies minimize disruptions to families, right? So what I'm happy to say is you can see that on this, like, EEC is doing pretty good with meeting the required provisions within the rule. For waiver submission, it looks like we're only going to need to submit a waiver for 2 of the required provisions, which is paying providers prospectively and capping family co-pays at 7%. Many of the required elements we have implemented already through our CCFA regulatory and policy reforms. And as it relates to contracts and grants, a lot of that work that they've outlined in the rule, we're directly doing it through our procurement, our contracted provider procurement, where we're looking at we're directly looking at increasing capacity for infants and toddlers. And we're ensuring that underserved areas are incorporated there as well, right? That was a part of the work that we did in the development of the contracted provider procurement, and something that EEC has been doing all along. There's only about 5 states that actually use contracts and grants to provide early education and care. So I'm going to pause for a second there. Commissioner, you can let me know if you want me to keep going or to give it a second.
I don't see any hands, so
Okay.
I know it's probably a lot. Oh,
Bethany.
here we go. Bethany.
Thanks. What on the copay, the cap of 7%, does EEC know what the average percentage is of current enrolled families, subsidy enrolled families? Any idea on that?
So we do, it's up to, right now, it's up to 17%. And we have some that are lower than that. So if it would take us some time to do some analysis to figure out what would the cost be to cap everything at 7%.
Mm-hmm. And I know, there's been discussion of this in the past for some time, and it's a big nut to crack in a way, I would think. And so what is your thinking on moving forward on that? So there's 2 years to comply. Did I read that?
So there's 2 years to comply, and we could go through the next slide and then talk about some of our next steps.
Great.
And that'll address
Okay.
what our plan is related to the 2 areas we're seeking a waiver for. Is
Great.
that
Yeah,
okay?
Yes, great, thank you.
And I can jump in for a second too, which is to say, clearly the 7% family income will have cost implications. So, and I can also have Jocelyn jump in because she did a lot of work on the current sliding fee scale, and like we're much closer than we might have been before. So, like all families below 100% are waived, and then a number of other families, but there will be significant cost implications to moving to 7%. So it'll be part of the budget development process for next year, where we talk about what it would take for us to comply with this federal rule, what the cost would be, but we don't have those numbers now. So clearly there's a big piece of work that has to be done to look at that current families and what it would take and what the cost would be. And then on the paying providers prospectively, which I think is great, right? That's like so much mimics more of what the private pay families experience, and we want everyone to be treated the same in our system. And that is going to be much more about the IT infrastructure to be able to make that process happen. So that will also be a level of effort, feasibility, timeline associated, but we're, clearly committed to both things. It's just a matter of over what period of time and what resources we can bring to bear on those.
Mm-hmm.
And I know you have some next step slides too, so.
Yeah, you summed it up pretty well. Essentially, that's what we'll have to do. And then this next group of provisions are what OCC is encouraging states, right? So states are encouraged to do these things. And at the top is waiving copays between 100 and 150 FPL, which we're currently waiving fees up to 100 FPL. Waiving copays for children with disabilities, that will require a policy change. We know that some children with disabilities are also DTA or DCF families, or some Head Start families, and other and families with children with parents under 24 and homeless families. So we know that we're currently probably indirectly already doing that, but that would require a policy change. And we're already currently waiving copays for homeless families. That was one of the big changes we made with our policy reform work. Waiving copays for foster care, where that's been an existing policy for for EC. And then the next one is waiving co-pays for children in Head Start. We do that by, because we're waiving fees up to 100 FPL. And also we recognize that there is a group of Head Start families that are over 100% FPL. And so we put our status here as requiring a policy change, as it would require for us to say all Head Start families. And then we currently pay providers the full established rate. And presumptive eligibility, the way that EEC currently does presumptive eligibility is really through our provisional eligibility when we are issuing provisional authorizations for families who may not have a service need. We're looking at expanding that as well. And then using other benefit programs for enrollment, right? So we currently do this through DTA and DCF. DTA documents are the documents that establish eligibility for childcare for EC, and on DCF, it's their policy that does. And of course, this is an area that we, of course, would like to expand in, as we know that there are other programs, like, for example, Head Start, that collects information that we could also use to determine eligibility. And then the last one is like an online enrollment procedures. That's a part of our, overall modernization efforts for childcare financial assistance, right? And so we started some of this online enrollment through our digital application, which is really Adobe Sign application, and through our Case Tracker pilot. So it feels good to see that we are almost meeting all the required provisions, and we are pretty much doing most of the encouraged provisions within the rule. Next slide. And so our next steps is to assess our needs, right? And so we're going to continue to assess what is needed to make the required changes. We're going to look at the required changes. And also we'll look at the changes that are encouraged as well, right? Are there things that we can do on both areas? We're planning on developing a working group and identify internal and external stakeholders for the engagement in that. We're thinking similarly to what we did with the childcare financial assistance policy and reg reform, pull in a group and say, hey, like, help us, what are your thoughts? So that we can ensure that it is a collaborative process, and then develop a roadmap for changes. And then we have to draft the waiver and submit it no later than November 30th. And there are probably 20 other steps that happen in between here, but this is just very high level. Beth Ann?
Sorry for all the questions, but it's
No, fine.
I think the waiver, the 7% is just such an interesting and challenging situation. Do you expect that, so in order to submit the waiver, will you need to put a dollar amount on this? Is that the goal by November 30, is actually try to come up with an estimate of what it would cost to get to that point? I mean, I would think this would be pretty substantial, would be a substantial cost.
Yeah, so you
And
just
of course-
outlined, you just said it, and the last sentence, the last couple of words is like, what we would be putting in the waiver is that this would be a substantial change and there would be cost implications. And we would need time to help figure out what that would look like. And that's the pieces that we'll be putting in the waiver, but we would need to at least have some ideas, right, of potential impact.
I think the waiver is designed to give us time to do that
is.
work, not,
Mhm.
we wouldn't be submitting the waiver with the cost estimate. It would be
I
submitting
see.
the waiver to enable us to do that work, which
Okay,
we will
thank you.
do in collaboration with our stakeholders.
Yes, yeah, that you answered what I was trying to ask. Because I would think, and then, then coming up with what the proposed plan would be to accomplish that is a challenge. So, thank you.
Thank you. Any other questions? Thank you. Thanks, everyone.
Great job, Tyrese. All the federal we think our stuff is complicated and trying to like make it accessible, what's happening on the federal level and respond. So thank you so much, Tyrese. That's really helpful. And we'll be sharing some of this with the board as well. Okay, are you ready to move into research agenda and KPIs? I'm sorry, I'm such a geek that this makes me feel very excited for EEC and the entire field. And we have such an amazing team being built under Amy Checkaway, and we even have a lot of research fellows. And so just really excited about the capacity being built at the agency to really think about the big questions and drive policy associated with data. So Amy, am I turning it over to you, and Ashley and Adrian?
Yes, thank you, Commissioner. I'm very excited about this as well. So we can go to the next slide. I'm just going to give a brief introduction. As I think many of you know, EEC has been organizing and tracking our work this year around 5 key strategic objectives, which are shown on this slide. And as the Commissioner said, as an agency, we are really prioritizing data and evidence-informed decision-making and building our own internal capacity to infuse data analytics and research into key initiatives, programs, and policies. So EEC's research director, Ashley White, has taken the lead on developing what I believe is our first draft agency research agenda that is going to serve as a guidepost and blueprint for agency research partnerships and laying out the key questions that will help us understand the effectiveness of our investments and where we want to go in the future. We have also been developing agency key performance indicators, or KPIs, which our data analytics director, Adrian Murphy, has been taking a lead role on in partnership with others across the agency and those KPIs will allow us to really consistently and regularly measure and quantify if we're making progress towards our goals right now. So I'm going to turn it over to Ashley and Adrian to share some more details. We're really eager to get all of your input, and also wanted to note that since our time is somewhat limited today, we are also hoping to schedule a follow-up discussion for any of you who are really interested in this and want to engage further in an even deeper discussion to provide additional feedback. We want the research agenda and our KPIs to, again, be reflective of input and what is of most interest to the field as well. So I will turn it over to, I believe, Ashley to start.
Yes, thanks, Amy. And hello, everyone. As the Commissioner and Amy said, very excited to be here with you today to talk about the research agenda and the KPIs that work that Adrian has led. And we're going to do a little bit of back and forth here this morning because of the sort of the work is sort of really connected, right? So the research agenda is meant to be sort of forward thinking, and the KPIs are really about measuring what we know now. And so me and Adrian will be going back and forth, but you can go to the next slide, please. So before I get going, I do want to just call out the fact that this draft research agenda was created via many conversations with folks internally at the agency and also some conversations with external stakeholders as well to get some high-level feedback. So I just want to say thank you to the team who met with me frequently over the last 6 months and provided their insights and thoughtfulness, and was able to kind of make sure that the agenda represented their priorities and their needs and interests. And so just wanted to share first kind of the purpose and the goal of this research agenda, and that is to really help drive agency work forward by articulating what our key questions are and aligning those with our strategic priorities. And we also want to bring transparency to gaps in our knowledge, and we want to highlight opportunities for continuous learning, both inside the agency, but also outside the agency. And we really want this to be a living document that is responsive to the agency's priorities and adapts to the evolving needs of the field. And so it is meant to be iterative. This is a draft, and we welcome all of your feedback, of course, but even when the agenda goes public, it is something that we anticipate sort of changing and evolving over time. The one thing I also want to highlight here is that the goal of this is really to also expand our research capacity. I think we recognize that EEC's ability to kind of answer some of these questions internally alone it can be challenging. And so we want to build research partnerships, but we want to build really intentional partnerships that focus on the priorities within the agency. And so we want to, align early childhood experts and researchers behind what we think are some of the most kind of pressing questions, efforts, and challenges. And of course, with your feedback, I want to make sure that those questions and challenges represent your priorities as well. So I think I'll turn it back to Adrienne now.
Great, thanks, Ashley. Sort of in addition to the research agenda questions, which are really forward-looking and thinking about what do we want to learn to do our work better, we've also been working with teams across the agency to design a set of KPIs that really will help us measure our success in reaching each of our strategic objectives. We really are thinking about identifying KPIs that are sort of guiding stars. It's not the sole set of metrics that we're tracking regularly. And we've tried throughout to indicate sort of what are our KPIs aligned with each strategic objective, and then what are some of the other metrics that we'll be tracking in addition to these KPIs as we engage in our work. In working with teams across the agency, we tried to focus on sort of 5 criteria for identifying strong KPIs. Identifying metrics that are within our control, knowing that all of these metrics are influenced by, a sort of a myriad of factors, including much of the work that members of our council are also deeply engaged in. But we wanted to make sure that there are indicators that if they're not on track, we as an agency have some tools to do something about that. We picked metrics that are quantifiable, hopefully that are easily digestible and meaningful to the field beyond the 4 walls of EEC, and interested to get your feedback, especially in that space as we walk through, that are realistic metrics that we can have an influence on in the amount of time that we're talking about measuring, whether it's monthly or annually, and then also manageable in number. I think this is the trickiest part because there's so much that we could be measuring, but if we measure everything, we're measuring really nothing. So trying to identify sort of what are those key guiding stars that will help us to identify whether or not we're on track to meet our goals under each of the strategic objectives. So I think Ashley and I, as she said, will sort of trade off. We'll walk through each of our agency strategic objectives, and she'll share a little bit about the research agenda focus under that strategic objective, and I'll talk a little bit about the KPI. So Ashley, I'll turn it over to you.
Thanks, Adrienne. Next slide, please. So we're starting with family access, and as Adrienne indicated, wanted to give you all just a sample of some of the research questions that align with the strategic priority. And so just at the top here, kind of highlighting some of the high-level focus areas for these research priorities, which would be reforming the child care financial assistance system and sort of access to early education at a school time care. And you can see some of the questions that sort of align with those high-level focus areas. The agency has done, I think, a ton of work to improve our child care financial assistance system to make it easier for families to increase rates. And so we want to measure some of the impact of those changes. And so some of the questions represent an interest and focus in those areas. I did want to also just flag in the slides moving forward, questions that have sort of stars next to them are questions where we have kind of at least one existing research partnership who is supporting us in answering these questions. And so you'll see that there are kind of a handful of questions on each slide where we're currently working with someone. And then there's a handful of questions on each slide where we don't have an established research partnership. And hopefully that's helpful to you all and to those who see the research agenda moving forward to be able to kind of engage with folks who may be interested in helping us answer the questions that we currently don't have research partnerships for. So back to you, Adrienne.
Great, thanks, Ashley. In the family access space, you can see we've, Addison, if you can pop forward one slide, thanks. You can see here the sample KPIs that the agency has been working towards in the family access space. In the family access, this includes metrics related to around participation in formal early education and care, both overall and for our subsidy eligible population specifically, as well as metrics related to our wait list. And then as you'll see, sort of these red asterisk metrics are metrics that we don't have the data to measure now, but we hope to be able to measure in the future and are sort of our more aspirational KPIs. And here we really want to emphasize that we want to build a family experience or family satisfaction KPI that we don't have a metric right now to sort of get more family voice in our measurement of success in their family access, but want to set that as a priority in the future. Ashley, I'll pop back over to you.
So the next strategic priority that we're both focusing on is program quality. And so the kind of high level topic areas here are how are we sort of measuring and improving program quality? And then how are we tracking early learning outcomes? And so you can see we already are checking some boxes in terms of being able to soon answer some of the questions listed here. I think one that's really interesting that we're going to be focusing on is sort of looking at elementary school outcomes for children who receive childcare financial assistance, and that's work that is going to be done over the next many months, and so excited to learn about that there. But I won't spend too much more time because I know we have a lot of slides to get to, but hopefully this gives you a kind of taste of the program quality focus questions.
Thanks, Ashley. On the KPI side in the program quality space, we're looking first at some data that we already have around sort of the reach of our EEC support. So many of our EEC programs, some examples here, and sort of the reach of those supports in terms of programs. And then also some metrics around sort of the formal use of curricula and observation tools. As well as data that we hope with the forthcoming educator portal that will be able to look more closely at the distribution of educators across the credential levels.
The next strategic priority is program stability. So we've got some questions about supporting the broader kind of system financing and then further assessing kind of the effects of operational funding. So you see two questions here around really on better understanding the kind of investments that operational funding allows programs to make and the extent to which that's having an impact on the field across a variety of different metrics here. And then the last question is sort of a nod to some of the cost model work that we've been doing. So understanding how the cost of running a program varies by region and characteristics and different compensation levels. And so as it started, that is work that has begun, and we're excited to kind of keep you all apprised of that work moving forward.
Great. And on the key performance indicator side in the program stability space, we're looking at our license capacity over time. Are we growing the capacity of our field? And then also the how many programs are both becoming licensed and remaining in the field for more than a year as a way to measure sort of the longevity of programs in our licensed childcare space.
And then I think this is the last one, a really obviously important area and strategic priority for the agency, and one that where a lot of great ongoing work is happening. And so some of the focus areas here are really understanding sort of the early educator workforce and the landscape, and then understanding kind of strategies and early educator outcomes. And so again, these are sort of some sample questions to give you a taste of kind of what we're interested in learning about. And a lot of work, I think, to come on some of this that we're hoping to really evaluate and understand the impact of moving forward.
Great. And then in the workforce support space on the KPI side, we're looking at data that we have from the Commonwealth Cares for Children program around our number of educators statewide, as well as the educator portal is under development. When we have additional data from that source, we can look at both the sort of distribution of educators across credential levels, as well as the movement of educators across credential levels over time to think about our impact in supporting the workforce. Addison, if you want to pop forward one more. I think you could look when we send out the slides, but this slide sort of looks across the strategic priorities at the various key performance indicators. This is the sort of grand collection across the priority areas, including both metrics that we can begin to measure immediately, as well as some that we will sort of add to our collection of KPIs over time as we continue to access additional data and data sources.
And then Adrian, before we get to sort of next steps, maybe we take a pause here. I know there's a lot of information for folks, and if anyone has questions or comments, happy to take them.
Helen?
Yeah, hi, thank you. I'm wondering if in any of your data, you're going to collect anything about public school preschools? Is that going to be part of it? I didn't see any mention of it there.
Yep. So when we talk in the family access space around the percent of all children participating in early education and care overall, we've been working with an outside vendor to do some pretty sophisticated modeling and combining data across data sources, which includes the data that DESE publishes around students enrolled in public pre-K and private pre-K. So that's sort of incorporated into the family access metrics there.
And same thing with educators?
No, our educator metrics, as we've contemplated them here, are educators in our licensed and funded childcare programs. But that's a good thought for us to take back and think about there as well.
Thank you.
Any other thoughts or comments before we move to sort of next steps on both these items?
There are questions in the chat.
Yeah, there's a couple.
Okay.
Yeah, one of them from Heidi is a KPI related one, wondering if enrollment trends would be helpful to consider as well. And yes, we do have information from C3 about enrollment, and I think are continuing to track that. So that's a really good point, Heidi. Amaris, I see there's a question about how we're approaching accessing information from families not participating in programs or with providers that regularly provide data to EEC. So we are engaging in some initial sort of needs assessment work through our federal preschool development grant to do an initial survey and some focus groups trying to capture families, especially those who are not participating in the formal system. And I know there's a lot of interest in continuing to build our knowledge in that area, again, especially to understand families who are not accessing formal care in terms of preferences and their experiences as well. So another really important point. I see there's a suggestion to focus on operational feedback related to our early childhood mental health consultation and current implementation. Ashley, I know we've been talking to the team and starting to think about what we can learn both from data we collect and perhaps data we don't collect yet. But if you want to say more or not.
No, yeah, no, I think that's right. I think we're excited about the question that we do have on there, but Laura, you make a great point, and I think we are trying to do some work in that space, as Amy indicated, around looking at the data that we do collect and really understanding what we better understand what we don't know and what we'd want to know moving forward. And appreciate that thought.
And Heidi does have her hand up.
Thanks. I just, it's great that in the C3 grants that we are able to put in our enrollment, but just to clarify, it asks for a total individual number of children, which is very different from the number of children that we have per day, especially for our after-school programs. So just in thinking about those numbers, we can have 100 kids enrolled for a licensed program and like 50 or 60 kids if you think about full and part-time kids. So the numbers are a little skewed sometimes.
Yeah, Heidi, that's a good point. It's very much on our mind how we might want to sort of revise how we're collecting information on enrollment to get an even better sense of what's happening there.
Excellent, thanks.
And then Carol had a question or a comment and just wanted to recognize. I don't think that's something that we necessarily had been contemplating, but absolutely something that we should take back and think about including and potentially doing some exploration around. Appreciate that.
I do think there is a lot of conversation. Aisha, I see you waving. Maybe you want to jump in too. That there is a lot of conversation going on around current data that's being collected around the CFCs and thinking about what the future state of that is. So maybe that's more in the like operational side. So family engagement as sort of like big questions and family support, but I think, you know, we, with the addition of capacity at the agency, have the opportunity to look at what data is currently being collected by the CFCs and think about what's being used, what's not being used, what's the most important data to be collected. They have a all-day professional development institute happening next week, where I think part of the conversation will also look at some of the data. Is that, I don't see Ajay, but Aisha, you're here. I don't know if everyone's met Aisha Rodriguez, or at least in her current position. So joining us from Horizons, our EEC's first ever family engagement manager. So, and Aisha, I know, is doing a lot of work with the CFCs. So what did I miss, Aisha?
Well, right at this moment, you'd know better than I. So I don't think it sounds like
You're like
not
on
much.
you're on day 18. Come on already.
Yeah, no, I'm still visiting, learning, but I don't feel like from what you've said that, from what I know, you've missed anything. But I'm excited to be here, excited to be working with all of you, and I'm pretty sure you're going to be hearing my voice a lot more as I get more acclimated. I've already got some strong thoughts and ideas that I'm presenting to the team, so that I think they're going to help the work a lot.
Aisha's position is actually funded through the preschool development grant, and one of her key tasks is to create a family advisory committee for the agency. So complementary to this group and much needed.
Yeah.
Tyrese or Amy Whitehead-Plow. Yeah, go ahead, Tyrese.
Yeah, I'm here. So I just want to share, like, we have been, Ajay and his team, so the family and community supports team, they have started the discussion around taking a deeper dive into looking into the data that's collected, because it is numbers. And how do we connect those numbers to actually children, so we could actually eventually at some point be able to see, like, how are families moving through our system, right? How are they moving? What is the true impact of the programs for those families who have decided, right? Because there are families who decide that they don't want to enroll in formalized care until kindergarten. And so being able to look at the data differently and ensuring too that we're collecting data that we can use and that's useful to the programs as well, right? We want to ensure that the data is telling us the story of what's actually happening. I know there will be some deeper conversations next week at the CFCE Institute, and they have a range of topics, a range of workshops that are going to be facilitated, from community-based support, early childhood, cultural responsive programs, how do we better serve families through the use of our PDC and Strong Start, intergenerational trauma, and building family resiliency. And there's some others. They're going to be doing, I think, additionally, something related to 2Gen playgroup facilitation. I wish I could attend next week. I wish I could attend, but it's happening at the same time that we're having an important meeting, our board meeting. So for those who can attend or are already scheduled to attend, we think it'll be a day that's full of, workshops that will be interactive. And there will also be a bigger conversation around rebranding of the CFC programs.
Thanks, Tyrese.
Yeah.
I'll just add just another point that I'm not sure if it was mentioned, but just want to highlight that we are hoping that again, once we get these KPIs in place and again sort of formalize additional metrics that that we want to track on a regular basis, excited to try to get more of that data into dashboards that could be posted publicly as well, to really, again, give greater visibility into our data, not just, for the agency, but for all of you. And look forward to phasing that in and keeping you updated, and then continuing to get input about what's helpful and like what other data would really help inform your work. and efforts.
That's-
as well.
And I think that's probably a nice segue to just the last slide.
Oh,
which is
sorry,
for-
maybe I took over the last.
No,
slide
no, not
by
at all, not
mistake.
at all, not at all. It's a great segue. Just wanted to kind of share with you all next steps. So in terms of the research agenda, I think timelines here are somewhat aligned between the agenda and KPIs, but I'll let Adrian hop in and add commentary as well. We're going to continue to kind of integrate feedback on this draft research agenda based on your input here today, which was super helpful. But as I think Amy indicated at the beginning, really looking forward to hopefully having some more individualized or smaller group conversations with folks to dive deeper into some of these topics and understand your interests and priorities. And so that work will kind of continue over the summer. And then the goal is to sort of publicly share these research priorities to, like I said, spread awareness and I think engender some engagement from researchers and funders and other stakeholders who may want to help EEC answer some of these questions. And that will be somewhere around the fall. And then over time, kind of continue to make adjustments to the agenda moving forward. And similar with KPIs, but Adrian, please chime in and talk about your work specifically.
Yep, I think our next steps in regard to KPIs mirror exactly those that Ashley talked about for the research agenda. We're going to continue to refine and revise these KPIs based on feedback, including great feedback that we received from you all today, feedback from our EEC board. And then our team has already begun to start to mock up and draft some dashboards to begin to measure some of these KPIs. And as we sort of begin to visualize and track these internally, as Amy said earlier, our goal is to evolve these into dashboards that are visible externally and to the public and all of you to begin to help us collectively understand our progress towards our agency priorities. And I think as you see underlying here, we'll continue, neither our research agenda or our KPIs are meant to sort of live in their current state forever. We'll continue to evolve both of these as we continue to evolve our work here at the agency. I think any other questions? Otherwise, turn it over back to the commissioner.
Great. Okay. Well, I think we're early. What? I thought it was it's good practice for us for the board meeting because we're a very full agenda next week, and we're hoping not to keep everyone until 6 p.m. Okay, folks. Anything we didn't cover that you want to make sure we talk about, or any last thoughts on some of the conversation we've had today? At the Workforce Advisory Committee this afternoon, of which there's a lot of overlap, we'll do the budget presentation that we did, but then we're going to provide the Workforce Advisory with an update on our workforce efforts, which will be very similar to what we did at our board meeting in April in Holyoke, although current state. So things have moved along, like the Educator Scholarship Program is posted and some other pieces of work have moved along since then. So chance to dig in with the Workforce Advisory on sort of the latest happening across our various workforce initiatives. Okay, well, enjoy a little extra time, and thank you so much for your partnership and your work with us, and see you all very soon.
Bye.